Hello everybody, Abhinaya I. Today we are going to discuss about few MCQs from the topic Pedodontics. Now let's come to the first question. The first question is, whom is effective behavioral modification technique in the age group of what? Option A 3 to 6 years, option B under 3 years, option C 6 to 9 years, option D above 9 years. So before answering to this question, let's see what is home. The full form of home is hand over mouth technique. So this is a kind of behavioral management that is used in children. So this was first described by Dr. Evangeline Jordan. So this is a very important MCQs. So people please make note of it. So what is it actually? So if there is a child who is little not cooperating with the treatment, so to seek the child's attention, to make the child understand what the dentist wants to convey, what does the dentist do? He usually closes the mouth of the patient with his hand and tries to calm down the child and explain the treatment or what is going to be done. So when you see about the indication, I'll just show you the key. The key of the answer is 3 to 6 years. So that is the answer. So this is indicated for healthy child who can understand what the person is talking and who is of age group 3 to 6 years and who shows an uncontrollable behavior. So these are the conditions in which home can be used. So let's see the condition in which this cannot be used. That is contraindicated for this technique is a child which is under 3 years of age, handicapped or immature child, or who is frightened, and physical, mental, or an emotionally handicapped person. So this is the contraindication. So once more, I'll just repeat the technique. Hand is placed over the child's mouth and the behavior expectations are explained calmly to the child. Child is told that the hand will be removed as soon as appropriate behavior begins. When child responds, the hand is removed and the child's behavior is reinforced. So there are other variations of this technique also, which is called as HOMAR, that is airway unrestricted hand over mouth. Hand over both nose and mouth, towel held over mouth only, dry towel over nose and mouth, wet towel over nose and mouth. Okay, can we just go to the people just go through this technique, hand over mouth. So it's a very important MCQs, potential MCQs. You get many questions from this one. Okay, so our next question is regarding Frankel behavior rating scale. So just go through the question. Okay. So according to Frankel behavior rating scale, a negative child is 1 who shows option A, who shows reluctance to accept the treatment with some evidence of negative attitude, who accepts treatment but at times cautiously. Option C, cries forcefully but accepts treatment. Option D, who refuses the treatment and cries forcefully. So when you come, to this question, before answering this question, you should know what is Frankel's classification. So Frankel is a person at 1962. He gave a behavioral rating scale. So according to the behavior of the child, it has been rated by Frankel in 1975. So 1962 it was given. In 1975 symbols were given for it. So what are the scales? Definitely negative, negative, positive, and definitely positive. So these are the behavior categories. Now let's go to the characteristics of the specific behavior of the children. So a definitely negative child is Ooh, huh. So, a definitely negative child is a child who refuses the treatment and cries forcefully. Negative child is a child who is reluctant to accept the treatment and displays evidence of slight negativism. A positive child accepts the treatment but during treatment may become uh, uncooperative. So, a definitely positive child who shows good rapport with the dentist, and this kind of child is a unique behavior. So, this is the rating scale which is given by Frankel. So, people just have a look of the table. This is very, very important. So, as I said before, this table, this behavior was given by Frankel in 1962, but Wright in 1975 gave a symbol to it. Like the symbol, like double negative, double negative, and single negative. That symbol was given by Wright in 1975. Uh, so, if let's go back to the question. So, since students have look of it. So, the question asks about the behavior of negative child. So, what is the behavior of negative child? Option D, who refuses treatment and cries forcefully? No. Who refuses treatment and cries is a behavior of definitely negative child. What about option C? Cries forcefully but accepts the treatment. That is positive behavior. So, option B, who accepts treatment but at times cautious. That is option that is definitely positive. So, option A, who shows reluctance to accept the treatment with some evidence of negative attitude. So, that is a key answer. So, the point here is uh, reluctant to accept the treatment. That is a key word for this question. Okay, next, let's go to the next question. This is a very easy one. What is the best time to see a 3-year-old child in a dental office? The options are A, early in the morning, option B, just before lunch, option C, just after lunch, and option D, anytime. Yeah. So this is the so the first appointments for children should be always scheduled earlier in the day. So this must be done so that the child is very alert and he is very fresh. So let's see about some. This is the key. So answer is option A, early in the morning. So let's talk something about first visit. The first visit of a child to a dentist should not be very frightening to the child. It should be more or less like an introductory, ice breaking session. The child should get first form the bond rapport with the dentist to who to whom he is going to be shown. Like the child should never be feel uncomfortable. He shouldn't feel frightened. If there is some non-cooperating side from non-cooperation with the side, reschedule can be done. So there will be building of rapport between dentist and the child should be in a very calm manner, and it should be the child should first develop a trust with the dentist. So the first visit should be very like taking of x-rays, examinations, and not using any restorative procedures or extractions and stuff. So every procedure to be done to the child should be explained first so that the child's fear will be little less. Okay, let's move to the next question. Paradoxical excitation in a child is caused by A, barbiturates, B, narcotics, C. Nitrous oxide, D. None of the above. So, yeah. So, the answer for this is barbiturates. So, what are barbiturates? And yeah, barbiturates results in general CNS depression. So it acts on the GABA receptors and are primarily used when a deep sedation is desired. This barbiturates, this causes generally hypotension and respiratory depression. But at lower doses, these medication can also cause paradoxical excitation. So why is this used? So this is a kind of form of behavioral management of the children in dental office using medications. That is pharmacological management of children in dental office. So note the point: nitrous oxide causes diffusion hypoxia when sedation is reversed at the end of the procedure. So coming back to the options, uh, nitrous oxide causes diffusion hypoxia if sedation is reversed at end of the procedure, when it has been when the sedation is reserved. And other type called dissociative type of anesthesia is caused by ketamine. So just make note of these 2 points. I'll repeat: barbiturates causes paradoxical excitation, diffusion hypoxia is caused by nitrous oxide, dissociative type of anesthesia is caused by ketamine. Okay, fine. Okay, chalo. Let's go to the last and final question for this session. Nitrous oxide more than 30 to 40% causes option A diffusion hypoxia, option B anoxia, option C amnesia, and option D ataxia. Let's go through the things. Okay, I'll give you some time. So what is nitrous oxide? So why it is given? So nitrous oxide is slightly heavier than air with specific gravity of 1.53. So it is a slightly sweet smelling, colorless, inert gas. It is used for sedation, conscious sedation for children. So let's see some of the pharmacodynamics of nitrous oxide. What does this cause? At the concentration of 5 to 25%, nitrous oxide causes moderate sedation, marked relaxation, diminution of fear and anxiety. When the concentration is around 25 to 45%, there is dissociation, sedation, and analgesia, floating sensation, reducing in blink stage, euphoric stage. So at concentration between 30 and 50, it will produce the relaxed somnolence patient, dissociation. In some patient, this may cause amnesia also, the 30 to 40 per 50%. So this has to be noted. So in the given option, diffusion hypoxia, anoxia, amnesia, ataxia, amnesia is more appropriate because at 30 to 40% nitrous oxide causes amnesia. At 45 to 65%, it causes total anesthesia, analgesia, and marked amnesia. So, some points to be noted are at more than 60%, it causes disorder coordination, giddiness, ataxia, and increased sleepiness. Routinely, nitrous oxide should not exceed 50%. People make note of it. The concentration should not at all exceed above 50%. One of the disadvantage of nitrous oxide is that it can be easily titrated up for stimulating procedures and titrated down easier period during easier periods of the procedure. Okay, so these are all things for today. Uh, so these questions are from Dental Pulse, and the reference is taken from Nikhil Marwa, Shobha Tandon, and McDonald. So I think the session must have been very useful for you. So have a nice day. Thank you.